Hi, my name is Ben Sapel. I'm the Artistic Director of Theater Delta, and we do theater for social change here in the community. And one of our many areas of expertise is doctor-patient communication. You all are going to see a scene. The name of the scene is Don't Worry, Don't Worry. And you're going to meet two characters. You're going to meet Dr. Kimberly Adams, and you're going to meet James Richardson. Dr. Kimberly Adams and James Richardson. But again, this theater is different because it's interactive. So at the end of the scene, the characters are going to remain before you, and you're going to get to interact with them. Now, we're going to do that a couple different ways today, but the first way we're going to do that is with questions. And you get to ask them any questions you want, any questions under the sun about what they did in the scene and why. So as you see the scene, and if you see something you're curious about, definitely make a mental note to ask that question of that character, because you all are going to have that opportunity. All right? Nods if that format's making sense for you? Questions? Excellent. And then afterwards, we're going to have a conversation about the issues. All right? We're actually going to talk about it. What came up for us? What are our reactions? What do we think? We want to hear from you. And again, the name of the scene is Don't Worry.
Knock, knock. Good morning.
Oh.
Sorry for waking you, Mr. Richardson. I'm Dr. Adams.
I'm sorry, what? Who are you?
I'm Dr. Adams. I'm one of the doctors here.
Okay.
How are you doing?
I'm hungry.
Yeah, sorry about that. Your endoscopy is scheduled for later today, so we need you fasting.
So I'm told.
We can get you some ice chips. Would that help?
I could use a cup of coffee. I'm getting a headache from not eating.
We just need to be able to see clearly later today.
I know.
So, Mr. Richardson, other than
And you
hungry...
can call me Jim. Jim.
Okay. Jim, other than hungry, how are you feeling this morning?
I'm tired.
Yeah, I bet. It's not easy being in the hospital.
You're telling me. I don't see how anybody gets any better in this place. I mean, they basically woke me up every hour.
Yeah, it's difficult. It's just that we need to be monitoring you pretty closely. You're having black stools. That means you're bleeding internally.
Yeah.
So how long have you had blood in your stool?
You know, I answered these questions already for the other two doctors, one in the ER and another when I was admitted.
I appreciate that. I just feel that it's important to ask again. You are losing blood. We need to be thorough.
It's not too much blood, right?
That's what I'm trying to figure out. So how long then?
I mean, I noticed it about three and a half days ago, and I was concerned, but I thought it was just stress and it would go away.
And how much black stool are we talking about? Can you describe it for me?
It's just a little bit.
Okay.
It was sort of a mixture, and it reminded me of the tar balls in the Gulf. And I was going a lot more than usual, you know. So last night I told my wife after dinner, and she told me to call the family physician. We did, and he told us to go to the ER, and the rest, as they say, is history.
Does your stomach hurt?
It has, but it doesn't now.
Are you dizzy or lightheaded?
I'm a little dizzy, but I'm also exhausted. It's tax season.
So it's a busy time.
Yes, absolutely. And I guess I get lightheaded when I stand up.
Is your heart racing at all? Do you get short of breath?
And sometimes when I stand up and walk around.
Have you had a bowel movement since you were admitted?
Yes, 2.
And?
It's the same.
Do you take any medications?
I take a fluid pill for high blood pressure and Lipitor for cholesterol.
Do you take any aspirin type products?
I take ibuprofen for my arthritis and after I play racquetball.
How much ibuprofen do you take?
I take it a couple of times a day after I play racquetball.
But how many pills do you take each time?
I don't know. It varies. 2, 3, sometimes 4.
How often do you drink alcohol?
From time to time.
Can you give me an estimate? How many days per week and how many drinks when you do
It's
consume?
2 to 3 drinks a week and maybe 2 or 3 drinks. That's about right. And do I have to have both of these IVs in? They're kind of uncomfortable.
Yes. Again, you are losing blood and we don't quite know how much. If for any reason it gets too low, we need to be able to replace what's missing as soon as we can.
Okay, so what are we talking about here? I'm sure it's nothing serious, right?
Well, you have a hematocrit of 30 and it's microcytic, so it's hard to tell how long you've been bleeding.
I'm sorry, what?
I'm sorry. The hematocrit is the percentage of your blood that's made up of red blood cells. It's low, and you might have been bleeding for a while.
It's low.
A little lower than normal, yes.
Well, what's normal?
In the 40s, but again,
That's not good.
well, it's not ideal. But at this point, we just need more information, and we are gathering it. The endoscopy will tell us more.
Yeah. Well, I think I've just been really stressed lately. You know, they're laying off people at my firm, and I don't know what's going to happen with me. But at least with tax season, they need a lot more people right now, so I'm good for at least a month. You know, I just can't have anything major wrong with me right now. And paying Cobra would be a fortune.
So,
My
Mr.
wife doesn't
Richardson,
work. So, what happens if I lose too much blood? What do you do?
well, again, it depends. For the moment, everything looks stable, but if it should happen, we would give you blood.
I have 2 kids in private school, and they're really happy there.
Uh-huh.
My wife told me last night that she's starting to look at websites like Career Builder to see what's out there. After the kids were born, she never went back to work, and I just feel sick about the whole thing. I mean, do I have an ulcer or something?
It's a possibility.
But I don't have cancer, do I? I mean, I'm not crapping the La Brea tar pit, so it can't be cancer or anything like that, right? I'm too young.
While cancer is a possibility, it's unlikely at this point.
It's a possibility?
Yes, but like I said, it's unlikely. I don't think you should worry about that at this point.
Oh, at this point?
I don't think you should worry about that at all. I just don't think you should be worrying about that right now. Jim, sorry. I do need to ask you one other thing. Something I ask every patient that comes into the hospital, but also when we might give them blood products. In the case of an emergency, do you want us doing everything we can to bring you back? And by that, I mean chest compression, intubation, or putting a tube down your throat, and shocking your heart. Again, I don't think it's going to happen. Don't worry, it's not that I think it's going to happen. I just have to ask every person that comes in the hospital just as a matter of formality. I have to.
Yeah. Okay.
Sorry, I don't know what you're saying okay to. Do you want us to do those things or not?
Yes, I guess so.
Okay, good. Then, can you sign these forms for me? Okay, sign here. And right here.
But do you have like a senior physician that you're working here with?
Yes, of course. The attending, Dr. Walker. He'll be by later during rounds.
Okay.
Is there a problem?
No.
Is there anything you'd like to discuss? Do you have more questions?
No, everything is fine. I just, you know, to be thorough.
Of course. Well, I'm going to go check on some more patients. And we will be back later during rounds. If you have any questions, we can answer them for you then.
If you could go ahead and turn to a partner and just have a brief 1 to 2 minute conversation for me, that would be great. And the prompt for that conversation is as follows. What questions do you have for these folks? Go ahead and turn to a partner. So let's go ahead and bring it back. So the way this works, folks, is if you have a question, you raise your hand. I call on you. You look the character in the eye, call them by their name, you ask a question, and they'll give you an answer. It might be helpful to review these folks' names. Sir, what was your name again?
Jim Richardson.
Jim, okay. And?
Dr. Adams.
And Dr. Adams. All right. What questions do you have for these folks?
At what point did you realize your interview was going downhill?
Good. At what point did you realize your interview was going downhill?
I certainly thought by the time we got to talking about cancer, things were not going well. But before then, I was frustrated because I wasn't getting the information I was trying to get.
Dr. Adams, I was just wondering, how long have you been working in the last couple days? Like, have you been having overnight calls or anything like that?
I haven't been on overnights, but I've been getting to the hospital about 5:36. We just started pre-rounding. I've seen 2 patients. I've got 9 more to see before I meet up with the attending.
I wanted to ask Mr. Richardson, was there a reason you were particularly worried about cancer?
Well, that's just one of the things that ran through my head, and I want to find out that I don't have it.
Short of reassuring you that you don't have cancer, which I think Dr. Adams couldn't do at this point, what could she have done to make you feel more comfortable?
You know, numbers. I'd like to know about a percentage of a chance that I, might have it or might not have it, and I wish she would have talked to me about some numbers.
What do you feel that's been done with you so far in the hospital has been unnecessary?
Well, I've had to see 3 doctors in the past 8-9 hours, and they're all asking the same questions, and I would wish they would get together and just ask me once. It's redundant.
Mr. Richardson, did you feel there was any information that you wanted to get across to Dr. Adams that you weren't able to?
Well, I need to let her know I can't be in this hospital for much longer. It's high time of tax season, and I need to be at work. And I wanted to know when I could leave the hospital and be back with my family and back working.
Dr. Adams, you mentioned information that you were trying to get. What exactly was it that you were intending to get out of it?
There's a list of questions, and yes, I know that he's already answered them, but we need to make sure that the record is correct. He'd been in various states of awake when he'd been answering the other questions, and we just need to be very thorough. And that's what I was trying to do.
Were you able to review everything that had been done up to now before you entered the room?
Quickly, but I did look over everything.
Do you know what an endoscopy is, and what other words might Dr. Adams have said that you didn't understand?
So I'm going to break that down. So first, do you know what an endoscopy is?
Not really. Not exactly. I imagine they stick a tube down your throat.
Okay. And I appreciate her other question as well, which is, are there any other things that she said that you didn't understand?
Yeah, when she was talking about my blood count or something, I think she used the term hematocrit. I'm not a dummy, but I don't exactly know what those medical terms are.
And is it okay if I ask your question of her as well? Specifically focusing on kind of the use of the term hematocrit.
Yeah, I shouldn't have done that. I was looking down at my paper, and that was a statistic that jumped out at me. I think in my sort of frustration and trying to give him information, it just sort of spilled out, and I wish I hadn't done that.
Mr. Richardson, you sort of brought up your financial struggles when the conversation about cancer sort of came up, and I was wondering if that's sort of what your worries were tied to, and if so, if there was a way that Dr. Adams could have helped you deal with those issues.
I'm not struggling financially, but if I can't get to work, I lose my job and my health care, and paying out of pocket for health care, it's just impossible. And I have 2 children at home and a wife to take care of. So, yes, it is a concern.
For Dr. Adams, how did you feel when Mr. Richardson asked if you had a superior who was going to be working with him?
Well, it felt familiar. I know I look young. I'm female. I don't know if that has anything to do with it. Maybe. I don't like feeling questioned or like I don't know what I'm talking about. So it didn't feel good, and I sort of just got that here we go again feeling.
This is actually for both of you. What were your initial impressions of each other?
Well, she woke me up out of my sleep, so I didn't have any impressions. She did seem young. That did go through my mind. She seemed young, so.
He seemed nice, maybe a little grumpy, but understandably so. So my first impression was, push on through, be cheery. It'll be all right.
This is for Dr. Adams. When Mr. Richardson brought up cancer, you reassured him initially, but he was obviously quite concerned about it. I was wondering if you regretted when you walked out of the room telling him not to worry about it at all, or if you kind of wished you'd approached that differently.
I didn't bring up cancer, he did. I don't think he has cancer, but I can't say you don't have cancer until we have all that information. I just can't say that.
So we are going to continue this conversation now, but first what I'm going to do is I'm going to put these characters in a timeout. So when I say timeout, for all intents and purposes, they cannot hear us, they cannot see us, and we will be free to talk. So if you all could just do your own thing for a little bit, timeout. So again, we are going to continue this conversation. Clearly there's a lot to talk about here. You all had a lot of questions, things you were curious about. So before we continue that conversation, just do me another quick favor. I'm going to ask you to turn back to that same partner or trio, and I'm going to ask you to have another brief 1 to 2 minute conversation for me. This time the prompt is a little different. Here's the prompt this time. You've seen a scene, you've asked some questions, and you've heard some answers. Now, what has come up for you all around these issues? What are you thinking and feeling around these issues? Go ahead. Wonderful. We'll go ahead and bring it back. So, you've seen a scene, you've asked some questions, you've heard some answers. Now, what has come up for you all? What are you thinking and feeling around these issues? Great, we're going to start here.
One thing that I got was this sense of incompetency that I think a lot of us feel now and coming up and for years after that. And I think it's going to be a constant struggle and something that we need to be prepared to deal with both emotionally within ourselves, but also verbally with our patients as well.
Dr. Adams, she couldn't win because it's like, if she spends all the time talking with the patient, which may be what she wants to do anyways, then she doesn't round on her patients. She gets yelled at for, not doing her job. And so it's like either way, she gets criticism from the patient or criticism from her.
Dr. Adams was sort of flitting around the room all over the place initially. And it seemed like that would probably fluster the patient a little bit. I know it was sort of just the fact that she was feeling rushed because, like she said, she has 11 patients to pre-round before she has to see her attending in the morning. And I just think we need to be careful in our future about sort of conveying our feelings of rushness onto the patient by doing things like that, and not just coming in and sitting down immediately and not seeming rushed in front of the patient.
I just wonder if it would help to acknowledge that it turned into an awkward interview. I mean, just kind of pause and go, this isn't going well. Can we talk about what's going on?
This is a little bit riding on what Tim was saying, but Dr. Adams seemed, even just during the question and answer session, to be emotionally vulnerable, more so than just something that, to me, is reflective of the little thing that we saw.
The kind of the impression that I get is she hasn't really gotten her routine down for putting patients at ease, because obviously isn't the first time she's walked into the situation of a grumpy patient who's scared and worried. I mean, that's generally what you get in the hospital.
We could recognize that any of us could be that intern in that situation, feeling uncomfortable as the patient is unhappy with us. So we were brainstorming ideas for how we could handle it differently, and just thinking that, anyway, that's
Great.
part of the work.
That's perfect. I'm going to hang on to both of those just for 1 second. And there was 4 down here.
I feel like there is a way to be in the room with the patient and just be there versus feeling like I feel like she's mentally not with that patient.
So she doesn't seem to have her routine down. I'm wondering how she could have done things differently. We've been brainstorming solutions back here. And we have, I wonder if there's a way for her just to be in the room with the patient. So I think the logical next step is to do what we do next here in Interactive Theater, and that's to bump the interaction up a notch. So this is what I would like to do, and I'd like to employ your help in doing that. In a moment, I'm going to bring Jim back, but this time I'm wondering if there's a brave volunteer or two in the audience who would like to come up and try this medical interview differently.
Mr. Richardson? Hi, Mr. Richardson.
All right.
Sorry to wake you. My name is Perry Tsai. I'm a second-year medical student here.
Good morning.
And I'm helping out Dr. Walker today, who's your attending physician.
Okay.
And you've been in the hospital for a few days now, right?
I just got here last night.
Last night, okay. And I see from your chart that you had some blood in your stool. Okay. Is that correct?
Yeah, that's what they told me.
Okay. And I just want to ask you a few more questions. You might have heard these already, but we just want to continue gathering information and making sure everything's correct.
Do you think I can get a cup of coffee or something? Something to eat?
Unfortunately, Dr. Richardson, Mr. Richardson, we're going to be doing an endoscopy on you later today to gather some more information, and we're going to need you fasting until that procedure. Are you familiar with an endoscopy?
I've never performed one.
So essentially, we're going to be looking inside your gastrointestinal system, your GI, just to see if we can find anything that might be causing the blood in your stool.
Okay.
Do you have any questions about that, Mr. Richardson?
Is it painful?
Some people might experience a little bit of pain, and we might be able to give you some anesthetic to help with that.
But how long does it take?
I think it should take no more than an hour.
So there's a chance I can leave today?
There is a chance, potentially, but we have to gather the information first and then see what we do with that.
Do you think I have an ulcer or something like that?
That's one of the possibilities, yes.
But not cancer, right?
With blood and stool, there's always a possibility of cancer. It's probably unlikely given your age right now. But it is, something that we always have in our mind. So we want to try to gather as much information as we can just to either rule that in or rule that out.
Yeah. So I've just been stressed at work lately,
Oh, yeah?
Laying off people at my job, and there's a chance I could lose my job. So I just can't have anything major wrong right now. I'm good for at least a month, but, I have 2 kids in private school. My wife doesn't work.
Yeah.
So I need to get out of this place and get back to my job. You understand that, right?
I totally understand that, Mr. Richardson. I understand that there's a lot of things going on in your life, and this is obviously not where you want to be right now.
And do I have to have both of these IVs in? I mean, they're kind of uncomfortable, and this one, I don't even think it's hooked up to anything.
Right. Yeah, I totally understand how those might be inconvenient and uncomfortable. The fact that you're losing blood through your stool means that at some point we might need to replace the fluids in your body.
It's not too much blood though, right?
Right now there is some blood loss, but it's not dangerous at this point.
Okay.
But we do need to be prepared to replace the fluids in your body in case anything gets worse or gets more severe.
All right.
But I mean, regarding the rest of your life, I understand that you don't want to be here right now, but there is blood in your stool. We want to get it checked out and make sure that whatever the problem is, we hope to fix it.
Well, how soon will I know something, especially about if I have cancer or not?
So the next step we're going to do is the endoscopy, and then after that information, we'll be able to further assess your situation.
And how long does that test take? Well, I know about an hour, but when the results come back?
So the endoscopy will happen later today, and pretty much the physician who's going to be performing that procedure will know upon looking, and also a little bit of discussion and potentially
So is that a week, 2 weeks, a month?
It should be at the end of the day or by tomorrow.
Okay.
Let's give Perry a round of applause. What did Perry try? As he's developing his routine, as he's developing strategies, as he's desiring to stay present in the room, what strategies did Perry try?
He stayed engaged with the patient the whole time. He had constant eye contact, and so I was actively listening.
He said he understood.
He had some warmth, and he said he understood, and his whole demeanor was so much calmer than kind of Dr. Adams again, flitting about was the term that we used.
And the way he talked to the patient was to concentrate on the patient rather than to bring in any sort of his emotional baggage into it. And also just repeating a lot of what the patient says, I think really helps them feel like they're being listened to.
When they say something, kind of echoing back via paraphrase, it allows them to feel heard, and also it allows them to kind of correct and modify anything that they don't see and agree with.
Well, I just thought that Perry allowed the patient to vent, and I mean, that's kind of, you know, that's the patient's right, and to just, you know, not listen to that, I mean, you know, it's a disservice. I thought he did a good job.
Great. He allowed the patient to vent. He simply listened. I think that's a kind of a trait to human beings, is that human beings want to be heard.
I really liked that when he came in, he introduced himself well, said who he was working with and why he was there, and then he just sat next to the patient immediately, like,
just listen. Yeah, that was wonderful. And he also, if I can connect your point to a point we heard here before, he kind of placed himself in the larger system, right? I mean, in this person's position, right? It could be all overwhelming. He placed himself in that series.
Mine kind of plays off of that even though that wasn't what he had intended on talking about, he did a good job of acknowledging the other things that were going on in the patient's life and that that's what was important to the patient.
I think if you timed it, I think this encounter actually went a lot faster. Anne stayed in the room, and someone was talking about being in the room, pulling up the chair and sitting down.
There are very small changes that individuals can make, very small changes that have a profound effect on the kind of interpersonal dynamic. I want to check in with Jim here. Jim, you were seen by a different physician, actually not a physician, it was a medical student. I want to know what you felt about this interaction and how you felt about this interaction, and did it impact you differently than Dr. Adams?
Well, he came in, and when he woke me up, he wasn't like super excited, and it didn't shock my system. He had a nice warm tone of voice, and it was easy to talk to. It seemed to be a good listener.
All right, let's give Perry a round of applause. We all know about the patient-centered approach. I mean, that's drilled in for us from day one. But I think the first kind of major point that you all hit on is kind of a transition to it's like not focusing on the information and getting that information, but focusing on how the information is obtained, right? And we call it this facilitative style of questioning with active listening and echoing back and kind of a calm demeanor to kind of keep you present in the room. So the shift from not just I need information to how I'm getting it. Because ultimately the relationship that you establish with your patients is actually part of the care. The relationship is the care. Two, we heard it starting over here and then echoed throughout, this idea that you are human beings and have emotions as well. And often we want to kind of be Superman or Superwoman or super people, and I can deal with it all, and I could do that. But then the emotions are going to come up anyway because we're human. So to kind of acknowledge your emotions in whatever state that you're in, and to kind of, by acknowledging, manage. If you've had a bad day, if you're in a rush, if you have 9 more patients, to kind of manage your own emotion. Another point you all made is this idea of empathy, right? This idea of empathy. Have it, right? Have it, or foster it, or develop it, or appear like you have it. And finally, this didn't come up as much today. It definitely came up more last week, but it came up. It just wasn't named as such. That obviously there are 2 people in the room. There's a doctor and a patient. And just to recognize that each of them has their own agenda, right? Each of them has their own agenda. The doctor wants information, and so that they can do diagnosis and treatment. The patient wants to be well. They want reassurance. They also want information. And so in the earlier iteration of the SEAM seem to be at odds with each other. Those agendas seem to be at odds with each other. So our goal as, your goal as physicians is to kind of see if you can take these 2 agendas and merge them somehow. They shouldn't kind of fight against each other. What techniques, what strategies can you use to identify both agendas that are on the table and have them work towards the same common goal?